Welcome back to Living Local. I'm Gail Kivistad, your host, and we're out in front of Neil Handel's office. And he's a plastic surgeon that specializes in reconstructive surgery. He does a mommy tummy tuck, and he also has the brand new fat vanquishing system. So let's go learn about it. Come on. Hello, Dr. Handel.
Hi, Gail. Nice to meet you.
It's nice to meet you, and it's a pleasure to have you in our community, because those of you out there that are looking for plastic surgeons and reconstructive experts, this is the man.
Thank you.
He's from Beverly Hills and San Fernando Valley and also taught at UCLA.
Yes.
And now you've just opened your practice over a year ago here in Santa Barbara.
Right. That's right.
And he specializes in reconstructive, sort of a tummy tuck, and also this new vanquishing.
All kinds of stuff. In fact, let me tell you more about it. Let's step into one of my treatment
I
rooms.
would love that.
Okay, great.
You know, I am really excited because you are such an expert. Okay,
you.
it's one of those things where they say, okay, find a doctor that's really done it a time and time again. Now, you've written the book, literally written the book.
That's true.
And this is all about problems in surgery. So you go in and fix things. So you do people
That's
the
correct,
first time,
yeah.
but then you also help
Right.
fix other people's work.
Right. Right.
And then now you teach about it.
I do. In fact, this is a textbook that was really written for plastic surgeons about correcting problems from previous breast surgery. And that's a big part of my practice. And I've had a lot of experience with it. And me and my co-editor decided we wanted to share our experience.
And it
with other
really
plastic
is
surgeons.
important to have someone with a lot
You
of
know
experience.
what? Experience matters a great deal. It really is the number one thing I think you need to look for. Somebody who's done a lot of what you're looking to have done.
Okay, doctor, I've seen this ad. I just saw this recently in the magazine. This is the only machine on the Central Coast. Right here, he brought it to Santa Barbara. This is the Vanquish Fat Machine, so everybody can look
Yeah.
fabulous at the beach. How does this work?
Well, this is really a brand new technology. It's very exciting. It's a non-invasive way to reduce fat in the midsection. Basically, the machine works using radio frequency waves, which are the same thing that are in your microwave. But radio frequency has been used for decades in humans. We know it's safe.
Oh.
And what the machine does, the machine doesn't even touch you.
No.
There's no pain, totally non-invasive. And this device emits the radio frequency waves, which heat up the skin to about 105 degrees, but they heat up the underlying fat to about 120 degrees. So it doesn't damage the skin, but it kills the fat cells. And then over time, those fat cells break down, and the lipids, the fatty tissue gets excreted from your body, cleared.
And you just flush it out of your system.
Right.
And your
So
fat just melts away, literally.
So basically, yeah. So it does take some time, though. I mean, liposuction is very gratifying because you do the operation and the next day the patient looks great when you take the dressings off. With this, you have to wait a couple of months after the final treatment. We recommend 4 treatments, spaced a week or 2 apart, and then patients wait about 2 months before we assess the final results.
And is the cost comparable to the liposuction?
Much less.
Wow.
Yeah, here's the advantages. It's much less expensive. It's
Okay.
completely non-invasive. There's no downtime. There's no discomfort. Those are the good things.
Simple and easy.
Yeah, that part is good. I would say the limitations of it are it's not as effective as liposuction. And we tell all the patients that.
Right.
This is for people who, for whatever reason, don't want to or can't have liposuction but want to do something to try to reduce the fatty tissue of the abdomen and the love handles.
Wow.
And our patients so far have been very happy, but I don't like to overpromise on this. I mean, I believe that it works, but people have to expect modest results, and I think they'll be happier that way.
And then you can expect great results from liposuction.
Absolutely,
So it just depends on
yeah.
what your comfort level is and what time you have and money. But this is a good
Those
first
are all
start.
factors: time, money, recovery, whether or not, some people are afraid to have general anesthesia.
And
all
this
those very
is no
safe.
recovery.
No, you walk out and go back to your, well, in your case, back to being
Back
a
to
reporter
living
on
local.
TV. Yeah.
This has been so informative, and the doctor just told me about the new FDA approval on the teardrop-shaped breast. This is new.
Yeah, absolutely.
And
it's very
exciting.
exciting. It is.
It
because
is.
for the last 20 years or so, we've been confined to just using round implants like this.
Right.
And now the FDA finally, after many years,
A real shape.
they've approved what we call shaped, form stable, or anatomical implants. So this, as you can see in
Wow.
profile, has much more of a breast shape.
It does.
I've found these are very useful in women with drooping. We can sometimes get improvement just
and
with
do a
the
lift.
implants. You get a little bit of a lift because this pushes the tissues forward.
So interesting.
And it also, for women who want a natural look, this is
Yes.
great. Not everybody wants a natural look. It's funny, sometimes I'll say to patients, now this will give you a really natural look, and they go, I don't want a natural look. I want to look like I had a boob job.
Isn't that
I
interesting?
go, okay, well then we use a round, high profile, more projecting implant. Still looks great,
Okay,
but
well,
not
I have a
completely
question.
natural. Yeah.
If you have a boob job and let's say you go for the largest size,
Okay.
what happens in 10, 15 years when you need to have them replaced
That
or you need a new surgery?
is a great question, and it's one that patients should think about because there are limitations. It's bad practice to put in breast implants that are too big for the patient's basic breast anatomy. I mean, what we do now, and this is fairly new, we measure the base width of the breast, we ascertain how much tissue is there, and that helps to guide us into the selection of the right implant.
This has been so exciting to learn all of this, and it's been really informative, and I
Good.
appreciate you sharing this, and I appreciate you being here in Santa Barbara so that I know that the locals are really taken care of when it comes to a big procedure like this.
We promise we're going to do our best. That's
you
for
so
sure.
much,
Okay,
Doctor.
so nice meeting you, Gail.
Fabulous.
Okay.
Stay tuned for more Living Local.